Have you ever heard of Non-Hodgkin's lymphoma, or NHL? It's the most common blood cancer and affects thousands of people worldwide. But what exactly is it? How does it present? And how do we treat it? Stick around as I break it all down in a simple, easy to follow way. NHL is a cancer of the lymphatic system that includes all lymphomas except Hodgkin's lymphoma. It is the most common hematological malignancy and is more frequent in older adults, but aggressive types also affect young adults. The symptoms depend on type and location, so we can divide it into nodal and extranodal disease. In the nodal disease, there is typically painless lymphadenopathy, which is the most common symptom. It also includes fatigue and weakness, and in high-grade NHL, rapidly growing mass or nodules are seen. In this case, there can also be B symptoms, which is fever, night sweats, and weight loss. In low-grade NHL, there are gradually enlarging lymph nodes. Hepatosplenomegaly may also be seen, and cytopenias with low red blood cells, white blood cells, and platelets. Here are some illustrations to make these symptoms stick. The most common site of extranodal disease is the gastrointestinal tract, which typically comes with bleeding and early satiety. The skin may also be involved, including rash, plaques, tumors, and ulcers. Paranasal sinuses, spleen, eyes, bones, and liver involvement may also be included. If there are any neurological symptoms, it includes headache. We can make a few illustrations to make it easier to remember. To diagnose NHL, we'll need blood tests, which includes complete blood count, which typically shows pancytopenia, leukocytosis, or it may be completely normal. High LDH and beta-2 microglobulin are markers of disease activity. Hypercalcemia may also be present, and viral serology may also be taken. The gold standard for diagnosing NHL is to take a biopsy. For nodal disease, lymph node biopsy is the most appropriate. For extranodal disease, excisional biopsy is taken. We can also do histopathology and immunophenotyping for this diagnosis. NHL can be staged with the Ann Arbor staging system. Stage 1 includes one lymph node area or one extranodal focus. Stage 2 involves 2 or more lymph node regions on the same side of the diaphragm. Stage 3 involves 2 or more lymph node regions above and below the diaphragm. And stage 4 is a widespread disease, including multiple organs with or without lymph node involvement. To treat NHL, most patients will need chemotherapy, and the chemotherapy which is preferred is the CHOP regimen. In case of CD20 plus NHL, Rituximab should be added. To make it more easy to remember this CHOP method, we can think of the NHL ice hockey players chopping a puck. Other therapy methods are radiotherapy, which are used in select cases, and surgery is rarely done as well. Supportive therapy includes treating anemia and pain with analgesics, antiemetics for nausea, and antibiotics and GCSF to prevent infections post-chemotherapy. The prognosis in case of NHL, 5-year survival rate is approximately 65%. The prognosis is worse than Hodgkin's lymphoma, and poor prognostic indicators includes older age, more nodal or extranodal involvement, and high LDH and beta-2 microglobulin levels. Non-Hodgkin's lymphoma is a complex disease with many different presentations. If you or someone you know has unexplained swollen lymph nodes, weight loss, or night sweats, it's worth seeing a doctor because an early detection can save lives. So if you found this video interesting or helpful, please like, subscribe for more medical breakdowns. See you next time.